everyone. Thank you once again for joining us this evening. As part of Incision Ghana agenda, the team for the education team have organized this program this evening to kind of enlighten junior doctors, surgeons, medical students, and medical graduates on exploring the possibilities in the field of trauma and orthopedics. So we are most grateful to all those who registered and have joined us, and special thanks
It seems we have lost our education lead again due to network issues. But so what um Jonathan would have continued with is to say that you are all welcome to this program, and we very much appreciate you sacrificing your time to listen to what we have to say. And with Incision Ghana, what we wanted to do is we would like to narrow the gap between those interested in surgical specialties and the people providing service and also expanding the field of those surgical specialties to help spread more information and awareness about these programs and just how much they could benefit the environment. By God's grace, we happen to get into contact with four amazingly talented individuals that have agreed to come on to this program and to provide some information to those that are interested in orthopedics and trauma, and also to answer all the burning questions that you have related to the field of orthopedics and trauma. So to start with, I would like to introduce our first panelist. The first panelist is in the person of Professor Alexis Bunaim. Those of us in the Tamale Teaching Hospital know him very well. He is currently an associate professor of trauma and orthopedic surgery with the University for Development Studies in Tamale, and is also the head of department for physician assistant studies. Professor Bunaim started his training. He has a master's degree in health professions education from Egypt, along with a spinal fellowship training, and he also has a postgraduate diploma in applied clinical research from the Macquarie University. He did his orthopedic surgery fellowship in the Macquarie University and is also a fellow of the Ghana College of Physicians and Surgeons. He's a fellow of the College of Surgeons of East Central and Southern Africa, and is a proud founder of the Platinum Orthopedic and Spine Clinic in Tamale. He is also a consultant trauma and orthopedic spine surgery of the Tamale Teaching Hospital. To Professor Alexis, if you could say hi to our audience briefly. Hello,
Okay.
Professor Alexis.
Yes, hi. Hi to everyone.
Hello, Prof. Thank you so much for agreeing to come on to this program for us.
Thank you for inviting me.
Okay. Then our second panelist is in the person of Dr. Clarence Batsogloyile, who is a senior resident in orthopedics and trauma with the Kolebu Teaching Hospital. He is currently a senior resident there who started his program 2 years ago in September of 2022. He's the co-founder of Metra Technologies, a company he started in 2017, which is aimed at providing health information management solutions to providers and patients. He has also won awards such as the Global Health Innovation Accelerator Awards in 2021 and was the runner-up to the SoundCloud Africa Summit in 2024. His training also included being a general surgeon at the Greater Accra Regional Hospital, what was formerly known as the Ridge Hospital, where he worked from 2021 to 2022. He also has a leadership in management of health from the University of Washington, And he started his training from the University of Development Studies, where he graduated in 2013. He worked there briefly before eventually moving on to Hull Regional Hospital and settling on orthopedics as his dream or his vision. And he's now working on that as a senior resident. Dr. Clarence, if you could say hi briefly to our audience.
Um, Hello, everyone. Good evening, and thanks to Incision Ghana for having me. Yeah,
Thank you very much for your time. So our next panelist is in the person of Dr. David Ayite Koko, who is currently an orthopedic surgeon at the Confanochi Teaching Hospital, where he has been working since 2021. He is also a part-time lecturer at the Kwame Nkrumah University of Science and Technology School of Medicine and Dentistry. He's a fellow of the Ghana College of Physicians and Surgeons with specialty in fragility fractures and orthopedic trauma. He is an AAOS International Scholar in 2017 and a member of AO Trauma and the AO Alliance Foundation. He has dedicated his life in enhancing patient care through bidirectional knowledge transfer. He would like to say a big thank you to Dr. David. If you could say hi to the audience, please.
Yes, hello. Hello, Incision Ghana. I'm glad to be here.
Okay, thank you very much, sir. And our final panelist is in the person of Dr. Anita Sefadodu, who is a junior resident in trauma and orthopedic surgery at the Tamale Teaching Hospital. She worked at the Tamale Teaching Hospital intensive care department for several years, where she got experience in critical care and also had some experience with trauma patients. It ignited her passion and desires to provide excellent care in the sense of trauma care to patients. So would like to say a big thank you to Dr. Anita for agreeing to be on this panel. Dr. Anita, if you could please say hi to our audience. Hello, Dr. Anita.
Yes, hello. Yes. Hello. Thanks for having me. I'm happy to be here. Yeah.
Okay, thank you all. So the format of this program is that when we were releasing the link for this program, we got some questions from our audience members, and they wanted to ask some questions to our panelists. So we'd like to start off with Jonathan, who would start with the question and answer section of this program.
Thank you so much, Dr. Munira, and thank you so much to our panelists for coming through to us. We'll go straight to our questions that we've gotten from our attendees. The first question is, in a minute, could you please tell us what inspired you to pursue a career in trauma and orthopedics, and then how you made it to where you are today? We'd like to start from Professor Alexis.
Okay. Hello. Thank you very much, Jonathan. What inspired me? Well, I must say probably the interest to do trauma orthopedics started from my housemanship days, where I did my housemanship in Holy Family Hospital in Techiman. There we had a surgeon called Dr. Wegdam, who was doing quite a lot of trauma surgeries. So that was my initial exposure to trauma orthopedic surgery after medical school. And I think that opened my mind and probably my horizon to what entails in that form of treatment. Then after which I came up to the north to practice. And we didn't have orthopedic surgeons. So most of our cases we had to probably prepare the patients and then transfer them. And unfortunately, most of them couldn't go to where we transferred them to or referred them to. So most of these people ended up with some form of disabilities or some complications that were associated with them. So, I mean, I saw that this was a gap and I had developed an interest and I had an exposure earlier on. So I decided that if I get the opportunity, then I would like to pursue that particular field of specialty. So that was how it all started. So I got the opportunity to do trauma orthopedics, a straight program in East Africa. And the reason being that having been working in the North for that period of time, I was exposed to general surgical issues. So I wasn't so much interested in a program that I could spend a lot more time doing general surgery, which I wasn't so much interested in. So when the opportunity came that I could do a straight program, I took it up and I went and pursued it with other ancillary things that were associated with it. So in a nutshell, that was how come I got into orthopedics.
Great. Thank you so much, Prof. We'll go to Dr. Koko on your take on how you came to pursue a career in orthopedics and then how you made it so far till now. Dr. Koko.
Yeah, thank you. I think for me, the journey started during medical school. Going through the various rotations in medical school and getting in touch with some orthopedic surgeons, the cases they managed. I was always fascinated by the results. So you see somebody, trauma patient, especially with orthopedic trauma, who comes in with complete inability to do anything, disability. And when they come back from the theater the next day, most of them, you see them mobilizing, they are walking, and the turnaround is so dramatic. Then, in fact, that's what inspired me. Right from there, I knew I would want to do orthopedics. So right after medical school, doing house job, in fact, I applied for the initial first straight orthopedics program that the Ghana College offered, which did not really materialize. So I did general surgery, first finished general surgery, and then went on to pursue an orthopedics fellowship at Kofanochi Teaching Hospital, which I completed, and I've stayed there as an orthopedic surgeon. And that's my journey so far.
All right. Thank you so much. We would like to go to Dr. Clarence, if you could tell us what inspired you to pursue orthopedics and trauma surgery, and then how you made it so far to where you are right now.
Okay, so to more or less take a cue from what my senior colleagues have said so far, throughout medical school, you sort of see who you want to become in future from the people who are living your future, vis-a-vis those who are doing this, who are specialists in the areas that you're interested in. So how they practice, how they carry themselves about, how they see their patients, and the outcomes they get. And so, in fact, most of my colleagues who don't know of my current status still think I'm doing plastic surgery. But throughout my medical school and then housemanship, and I started this in Somali Teaching Hospital. So Professor Bunaim was a medical officer then when I was, I think, in fifth year medical school. So all the descriptions is given to life at the time are things that we experienced, and we learned from him as our trauma medical officer as to how he carried himself about. And the few orthopedic surgeons we had just displayed this grasp of anatomy, which was very difficult to those of us in UDS at the time. And so that comfort with knowledge, that ability to carry yourself confidently through your case management and get favorable outcomes, then points budding medical students in the direction of, okay, this is who I want to be. And so that's the inspiration behind it. In terms of the pathway, I just took the available opportunities as they presented themselves. Ghana College, General Surgery membership. At that time, we didn't have a straight fellowship available. So after membership, then I applied for a fellowship. And yeah, yeah.
Right. Thank you so much. We'll now go to Dr. Anita on your take on what is and then how you.
Okay. Mine is not so different from Dr. Clarence's own. Also, as a medical student at the UDS, we used to attach to Tamale Teaching Hospital. We were with Prof. and Dr. Tolgu. I saw how dedicated they were, so disciplined to time and everything. I mean, they were always on us to study something. And so I really wanted to be like them. And so it had always been in my heart to be like them. But when I finished medical school, I lost my mom. And so I also realized how it was going to have a toll on my social life and all that. So I decided to change my mind to go to anesthesia. And that's how come I ended up in the ICU. But I got there and I realized that I wasn't happy with it. So I had to come back to my first lab. So it's through Prof. Dr. Togu's discipline and all that. That is what inspired me. And there was also no dull moments with them. When you go to their theaters, their chisel, their pinnings and everything, it was so interesting. And I just loved it. So that's how come I loved it. And then when they introduced the straight course, I happened to know Dr. Prosper Mo. He was the one who first told me about the straight course, and he encouraged me to write the primaries. I was dragging my feet, but he was checking up for me. Have you written the exam? Are you learning and all that? So I took the opportunity to write the primaries, and I'm here. So that's how I got here.
Oh, great. I see Prof has inspired a lot of people and you continue to do so to many of us. So our next question is on what do you think sets orthopedics apart from other specialties? What is orthopedics and trauma surgery from other specialties in surgery? So we'll start with, hello.
Yeah, hello.
The question is, what do you think sets orthopedics apart from the other specialties in surgery?
Well, this is a very interesting question. Well, if you go by what David started with, talking about, if you read a lot about some of the American literature about surgeons and job satisfaction, and they ask people which specialty you would like to do if you had opportunity to choose again, you realize that almost all the time the orthopedic surgeons are always top there. They will always want to still be orthopedic surgeons, even if they had to go and come back. One, I think one of the main things is the fact that you see your outcomes there and then. I mean, somebody comes in and probably disabled or maybe shattered his bones in several parts, several ways, and you look at it and it's like a jigsaw. You first of all plan how you're going to fix this jigsaw, and you go in and you're able to execute it, and then you see the results there and then. That is doing your x-ray. I mean, that's what we call the policeman for the orthopedic surgeon, after which you see the outcomes from what the patient is able to do. And you go home satisfied and you sleep very well. That alone in itself gives you some kind of job satisfaction that you would like to have when you treat patients. So I think for that, it sets orthopedic surgeons far, far, far from the rest. And secondly, there is no one fracture that is the same as another. Every fracture or every orthopedic injury has its own personality. So you never get bored in treating these injuries. So every day is a new day. Every day is a new trick. Every day you have a new plan. So I think it puts you on the edge and you are always up to doing something, and it sets you apart from other specialties that probably it's almost like the same thing you are doing over and over again. For me, that is what I think really sets orthopedic surgery from others. Thank you.
Oh, okay, okay, okay. Dr. Anita, can you um, enlighten us on what you think sets orthopedic surgery apart from the other specialties?
It's not very different from what Prof said. Orthopedics, we deal with the upper limbs, the lower limbs, the spine as well. And you have so many, you have the shoulder joint, the knee joint, the hip joint, the ankle. So every day is a new day. We are dealing with a lot of things all the time, different things all the time. So you never get bored. And as he said, you see results very early. You put an IM node, the following day, patient can walk and you are happy. You get to talk to your patient. Elsewhere, sometimes the patients come, they have to wait for some days before they start feeding and they look sick and all that. Orthopedics, once anesthesia wears off, patients are eating, you get to talk to them and they're happy. And so it sets that apart. Yeah, that's what I think.
Wow. Okay, that's great. That's great to know about orthopedics. Our next question go to Dr. Coco, then Dr. Clarence. And we want to know, what do you think is the biggest misconception about orthopedics? So we take it from Dr. Coco, then another take from Dr. Clara. So we start with Dr. Coco. What do you think is the biggest misconception?
Yeah, one of the big, in fact, I think quite a number of misconceptions when it comes to orthopedics. And one of the biggest ones, I think, is that you need to be physically strong to be an orthopedic surgeon. I think it's one of the biggest misconceptions. I see some of the guys are laughing. Well, Prof is also laughing. It's you see, anytime for orthopedics, I think anytime you need to exert excessive strength, there are two questions you have to ask yourself. Why am I having to do this? And what am I hoping to achieve? Because really, at that point, it's either you are applying a wrong technique to achieve the goal you want to achieve, or maybe you don't even need to do what you are doing in the first place. Right. So I think that's one of the biggest misconceptions. The second one I would really like to touch on. I have a love for orthopedic trauma. But trauma is not the only thing orthopedic surgeons do, or fractures for that matter. We do a lot of other things aside from dealing with fractures. In fact, we deal with the whole musculoskeletal system. So there are people who deal with sports injuries. A lot of them do not have anything to do really with bone, but muscles, tendons, and ligaments and other things. There are people who deal with just pediatric deformities, a lot of them which are congenital, like birth deformities. And that's all they deal with as a subspecialty in orthopedics. So when you come to orthopedics, it's not just about the trauma, the fractures. It's not just about fixing broken bones. There's a lot more that goes into it, which when people join the program, they quickly find out. I think those are two things I would want to touch on. Yeah.
Oh, great. Thank you, Doc. So we will take a take from Dr. Clarence on what he thinks is some of the biggest misconception about orthopedics and trauma.
So to continue on on that tangent, I think there are lots of memes out there that says orthopedic surgeons don't know medicine, which is quite interesting sometimes to read and to see. So if you break it down a bit, we are trauma and orthopedics, which means we do a lot of what the emergency physicians would do. We have a great grasp of surgical principles, as do the which is equivalent to what the general surgeons have. We do a lot of geriatric care because we deal with a lot of elderly people. We deal with a lot of pediatric care, from infections to congenital anomalies. And in fact, if you look at the name orthopedics, if you break it down, it's ortho and pedics, which uh, literally translates to street child. So pediatrics is a very core part of who we are. We deal with a lot of oncology with bone tumors, primary, and remember that for most other tumors in the body, especially with the paired organs, they would all metastasize to bony structures. And so you have an orthopedic surgeon in there. So we pretty much cover most ground. And so contrary to popular opinion, we don't just come and fix bones and then carry your instruments and walk away. We do a lot of medicine that is found in the other specialties. And the second one is that we are all about money. We're not all about money. We make as much money as everybody else. So we are not all about money. All right.
Oh, great. So, hopefully, any additions to the questions so far on
Anyone?
some of them, additions to some of the misconceptions about orthopedics?
Oh, I think the last one Clarence just talked about, the issue of the fact that it's not all about money. I always say that there is no any specialty that if you master the art of that specialty, you will not be able to make money. I don't think there's any specialty. I'm waiting if anyone can give me one that he thinks that there's no money in that specialty. Because if you even come to think of, most of our residents will tell you, when you're a resident in trauma orthopedics and you're a resident in, let's say, obs and gynae, who makes more money? I'm sure the obs and gynae guys make more money.
By
You get,
far.
yeah. And people just misconceive the fact that, oh, orthopedics, oh, they make money, they make money. But I don't think that's actually the case. It just deals with you being good at what you are doing and being able to do it well. Definitely, you make money from it. So that's what I just have to say.
All right. Thank you so much, Prof. So our next question, we want to start with Dr. Anita. Um, what advice will you give to medical students or a junior doctor who is considering trauma and orthopedics surgery as a specialty?
Okay, anatomy. You have to learn your anatomy. You don't wait till you're coming because anatomy is going to follow you to because orthopedics, your anatomy, you come, you are dealing with biomechanics, you are learning the conditions. So if you have your anatomy, I think it will be a good start. So we shouldn't sleep whilst you are doing house job. Wherever you find yourself, whichever unit you find yourself, once you want to do orthopedics, start your anatomy. Because sometimes in medical school, you just learn to write the exams, you forget so many things. But orthopedics, everything, you need your anatomy. Even whatever you want to do, you have to know the anatomy. So I advise them not to forget the anatomy, because if I had this advice, whilst in ICU, I would have been revising. I'm still revising anyway. Prof is laughing. So please, your anatomy, you have to start revising very well. Thank you.
Oh, great. Thank you so much. Anatomy. Dr. Clarence, is it any other advice you want to offer to medical students or a junior doctor who is considering orthopedics?
Well, I think in the practice of orthopedics, and this is something I picked up from a lot of my junior colleagues when they come either as house officers or as residents to start, they tend to forget that, or we tend to forget that, we tend to forget all our medicine. And so, from what I said from the previous question, you would need to manage the whole patient and then manage their orthopedic problems. So all your medicine has to be brought on board. If you're coming to do orthopedics, you should be prepared to be able to fully and comprehensively manage a patient, especially people who are critically ill, people who have just had very bad road traffic accidents, people who have malignant conditions. So all your medicine has to be brought on board to be able to fully manage and be a successful orthopedic surgeon. Every orthopedic surgeon worth his or herself has to do comprehensive patient care. And so in coming to do this program, you shouldn't throw everything away. In fact, bring everything on board. All your experience and knowledge in patient care has to be brought on board in managing your patient. And that's how you become a successful orthopedic surgeon. It's a lot of diligence and meticulous work. You have to apply yourself a lot. And there's something Prof just said about mastering your art. It's a science and it is an art, being an orthopedic surgeon. And so if you master your craft, if you master your art, that's when you reap its rewards. It can be a very unforgiving specialty if you're not very good at what you're doing. And so it's not an easy place to be. It's quite tough. The knowledge you need to bring on board sometimes surprises a lot of people. There are things you probably have never thought about. You just think it's a bone is a bone is a bone. Absolutely not. There are so many mechanics that you haven't thought about that comes into play. There's so much. I was I was blown away by the amount of physics I had to go and revise just to understand body mechanics and how to apply that to the biology of the human being, to understand that, okay, if they say plating, I'm doing just put the plate anywhere. I have to know exactly why I'm using what I'm using. In the hands of anybody, a plate is just a plate. In the hands of an orthopedic surgeon, it's a device that can be deployed for so many things to solve so many problems. So your two things: one, fully bring on board all your medical knowledge to be a successful orthopedic surgeon, and then you need to apply yourself to understand the principles and management of orthopedic patients. Thank you.
All right. Thank you, Dr. Clara. So our next question, we want to know how mentors have played a role in how mentors are pivotal in shaping your journey to orthopedics. They are either from trauma and orthopedics specialty or they were from different specialties. How were mentor pivotal in your journey to becoming an orthopedics and trauma surgeon? So I'd like to start with Dr. Koko. Your take on how mentors play a role in your journey to becoming an orthopedic surgeon.
Yeah, that's a very good question. So when it comes to mentors, right, they are important for everybody, irrespective of what field you decide to go into. I would say that if I use myself as an example, there are people who have been pivotal on this journey because at times, and as Clarence alluded to, you get in and you realize that there's much more to this than you thought there would be. There's much more you needed to do. And Anita also said something. If somebody had told me about this anatomy thing, I'd have been better prepared when I entered. So for me, that was pivotal. I had people who were just ahead of me, maybe 3-4 years ahead of me, who were in the program, who I consider my mentors. So I'll mention some of them here. Dr. Kunudu Yeboah, Dr. Prof. Kwanzaa, Dr. Beidu, Prof himself, when those days when he had started in East Africa, we conversed a few times. And they would always tell you one thing: look, do this, do that, do that, do that. You understand? And that put you in a pivotal position when you started the program or when you moved to a new rotation, or because you came in prepared. I would say that I entered the program in terms of the knowledge to go through the program. I came in prepared. Although in some other aspects, I was also unprepared. I think everybody has their own story and everybody will tell it at the appropriate time. But mentors are really important. They will show you the way because people have done it before you and can show you how to do it. And apart from just mentorship in terms of what to expect, mentorship also important in giving you direction as to the prospects and the path which would be best for you to tread. I mean, people enter orthopedics for different reasons. If you want to be an academic orthopedic surgeon involved in research and other things, there are certain things from day one you should be very much aware of, right? And that's when I say I was prepped in some ways and others very, very unprepared, right? To realize that when you finish the orthopedics program, it's not just about providing service to people. You should also be prepared to advance knowledge in whatever field you find yourself in. And in the field of orthopedics, there's so much to study. There's so much we need to push in terms of advancing knowledge. So research, and I would encourage everybody from the first day you enter into the program, you will see problems or challenges, then put them as challenges, which you face. And those should become stepping blocks for you to build something on. And I mean research. Turn the problem or the challenge to a research question and answer it. Maybe something as simple as maybe junior residents have problems understanding biomechanics. What can I do to help that? So when you move out of that, people will not have the same challenge you had, right? So these are things you need, and that gives you a certain perspective and builds a certain culture. And mentors are very important in opening your eyes to that aspect of orthopedics. A lot of the time, our eyes are closed to it. And I think you need to have the right mentor. So as you enter the program, you need to identify people around you who you think can help you, that you take up as mentors. It's a very important thing to do. Thank you.
Oh, great. Thank you so much, Dr. Koko. Professor Alexis, can you tell us a bit on how mentors play a role in your journey to become an orthopedic surgeon?
Yeah, thank you very much. I think, David has said it all. What I just want to add is there are these two things that probably we are not usually exposed to when we are in med school and sometimes even in residence. You have a mentor, we have a mentor, and then we have a coach. Now, usually mentors are people that let's say you choose to do orthopedics, more often than not, it's advisable that your mentors should come along that line. They are virtually probably in the field, and whether you are working with them directly or indirectly, that is to say, whether you are in the same center or in the same hospital, in the same country, or you can have a mentor who is even in a different country. Then we also have coaches. A coach can be, somebody who is in a different specialty or probably even in a different field, but is able to give you some tidbits as to how to go about your professional career in one way or the other. So these two are quite distinct, though they work towards shaping you to become a better person in whatever you do. And I must say, it was quite a bit like I started by telling you that when I started my house job in Techimine or Holy Family Hospital, the first mentor I met there was the Dutch surgeon who was trained in a bit of trauma and used to give us some encouragement and then try to push for us to do. But mainly what he was doing was mainly trauma surgery, mainly fractures and that, but not into other aspects of orthopedics. And then I happened to meet Dr. Prosper Mo, who was, also the other side. He was doing quite a lot of orthopedics, not so much trauma. But then he gave me two perspectives. It means that you have this side and you have the other side. So you have the trauma, you have the orthopedics. But the training is both, you know. And then when I decided to do the program, I went to Uganda, Makerere University. I met quite a number of mentors there who were interested in, most especially foreign students, that they think you are serious because you are there, you are paying fees, your time is limited, you must be able to finish on time. Otherwise, you know, you are either spending more money, you are away from your family and all that. And I mean, they guide you as to what to do. For instance, like David was saying, if for instance you are doing a program, you have to write a thesis. You have a mentor who is able to tell you that, okay, start looking for a topic. So let's give ourselves the first 3 months. Come and give me 3 different topics that you want to do. And then you're able to do that. He reminds you, you meet and then you discuss. And he says, okay, go and write the proposal. You get it. Then gradually, he's able to mentor you to the point that your proposal is ready and you go ahead to start your whatever career. Then those who are also very good at looking at the performance-based mentorship. I mean, these are people that probably they meet you in theater, they take you through what you are supposed to do and teach you step by step. And then they hand it or the scalpel over to you and for you to do something for them to see and then assess you. So you can see that you might have a mentor who is not all in all, but probably very good in one aspect, another one in another aspect. That's why, I mean, it's not said that you might just have one mentor. So in my career, I've had quite a number, and each of them had a specific, if I might say, specialty or gift in one area. Then you try to pick from each of them, and then you also build yourself up. So in a nutshell, I think that has been my story during my career.
Great. Thank you so much, Professor. Prof. So our next question, we want to take it from Dr. Anita, then Dr. Clarence. What is the current length of training and which institutions are responsible for training specialists in orthopedics? So we take from Dr. Clarence, then we take from Dr. Anita, the current length of training and then the institution responsible for training.
So currently we have a mix of 2 groups of residents in Ghana. We have the old system and the new system. So the old system had people who had a 3-year training in general surgery and have applied to have a fellowship in orthopedics. And so the membership is 3 years. The fellowship is a minimum of 3 years. And this goes for both Ghana College of Physicians and Surgeons and the West African College of Surgeons. The new is a straight program, which is also split into 2. It's 3 years of a membership, after which you write an exam, and then you continue with another 3 years of a fellowship. So that's officially is the duration. Why I say a minimum of 3 years is that Dr. Alex quite touched on this a bit in his previous submission. You would have to make sure that you meet all the requirements to finish the fellowship in 3 years. And one of the biggest rate limiting step with that is having completed your dissertation. So for anyone who is coming in, you need to start working at that, because for a lot of people, what keeps them in the program longer than the minimum 3 years is that their dissertation is not completed. So whilst you are gaining your skill and knowledge, you need to start from day 1 working on your dissertation, so that in 3 years you're able to finish it and submit it. And then you can meet the minimum of 6 years for the training for the training of a candidate. So for the duration, that's it. It's a minimum of 6 years.
Oh, great. Thank you so much. So our next question, we want to know what you believe is the future for orthopedics and trauma. So we'll take it from Dr. Koko. what you believe is the future of orthopedics and trauma?
Well, in terms of future, I think for orthopedics and trauma, let me borrow a cliche here. The future is bright. But when I say the future is bright, I'm saying that because when you look at orthopedic surgeons currently in Ghana, the number is not great. We are not more than 100. I think probably no more than 80 currently. Right. But looking at the numbers in residency, in the various years, I think I would not be wrong in saying that probably in the next 5 years, the number should double, probably. Well, probably maybe a bit more than that, maybe say 6 years, the number should double. And I'm saying it's bright because if you look at the number of surgeons to population ratio in this country, we are way below standard. And so there's a lot of work out there and few people to do the work. So there's a lot of opportunity. And also, as we are moving forward, both Ghana College and West Africa College are also starting to offer or establish subspecialty programs. What do I mean by that? So if you finish your fellowship in general orthopedics, you could branch out into one of the subspecialties, like Prof. Alexis has done orthopedic spine surgery, right? Like I am doing currently orthopedic trauma, right? Others have done pediatric orthopedics. There's some people right now who are doing sports orthopedics. There are people who are doing just arthroplasty, that's joint replacements and joints. There are some subspecial like foot and ankle surgery, upper extremity surgery, orthopedics, hand orthopedic surgery. So there are so many subspecialty where right now there is nobody. Okay, so it is something that we can all expand into. So there are opportunities. And there's one thing I loved that Prof said about mastering your craft. So once you finish and you have that opportunity to subspecialize, which over the next couple of years, especially for those who are entering the program now, that subspecialty training should be available in the country for most of the subspecialties. You will be able to enter one of these fields and master it. And once you master it, unless something bizarre happens, your future is bright. And if you take it seriously, you should be able to expand that. In terms of service provision, in terms of research, because there's a lot of gaps in research in orthopedics out there. A lot of things that in the developed world, they are unable to study because the pathologies simply do not exist anymore or have ceased to come as frequently as they used to, right? So opportunity is there. And there's a lot of opportunity in terms of also, let me put it this way, your practice, enhancing your practice. The more you are, the more opportunity there is for group practice establishment, where you have more control over how your work is structured. Currently, most orthopedic surgeons work in government institutions or big private institutions. We don't have so many small group practices. So that is also there. So what I'll say is that the future is bright and it's up to us to make the most of it currently. Thank you.
All right, thank you. So, to Dr. Anita, what we would like to know for the women that are also interested in specializing in orthopedics and trauma is how does this specialty affect your lifestyle?
I think like all surgical fields, once you want to become a surgeon, your life may be affected in a certain way. Already, surgeons, we are not that type, maybe one or two, I've seen one or two surgeons who are like outing and all those things, but I would say most of us, we are not the outing type. Well, for the women, people like me who are married and have children in orthopedics, I mean, it's not an easy thing. You need a strong supportive system. You need someone to be there for you, or else you can't do it alone. You can't do it alone. So you have to discuss your husband, maybe if your mom is alive, your family, you need someone to support you. As a resident, it is not easy at all. But if you have these support systems, I believe you will be able to pull through. You cannot attend all family meetings, all gatherings, all funerals and all that. But I believe that as you go along the ladder, things may soften a bit. But as a resident, as a surgical resident, I mean, looking at how the training is, it'll have an effect on your social life. But if you have these support systems, you'll be able to pull through. That's what I can say.
Thank you very much. Our next question is for Dr. Clarence. What we'd like to know is what aspects of the training do you find most appealing? Hello, Dr. Clarence.
Hello, can you hear me now?
Yes, please.
So, in terms of appealing, I think the skill transfer in orthopedics is quite rapid. To say it lightly, our bosses aren't very stingy with the skill. They will teach you a lot. And they teach you quite quickly as long as you start understanding the principles behind. So you get to learn a lot quite quickly because the workload is a lot. You get to do a lot quite quickly too. And so you become quite competent and skilled quite quickly. And that gives a resident a lot of satisfaction in what they are doing. It's a lot to read a lot and learn a lot, but when you don't get to practice the art, it becomes a bit depressing sometimes. So what I'm appreciative of and what excites me about my training is that I get to have a lot of hands-on sessions. In 2 years, I've learned so many things that sometimes even impresses me myself. So for the training, it's a lot, it's intense. And you spend a lot of hours in the hospital. But that also means that there's a lot of opportunity for you to learn and perfect your craft and your art. So that's what I find most appealing about my training. Thank you.
Thank you very much for that. To Prof. Alexis, some of our audience members had a few questions about private practice. And so we wanted to find out from you, what inspired you to set up a private practice, sorry, and what were the challenges you faced in starting up?
Yeah. Okay. Thank you very much. Of course, I think doctors should be interested in private practice. That probably is the future. Now, if I want to pick on, I went off a bit, but when I came, I heard David talked about a lot of opportunities that are available in orthopedics because you have so many specialties and all that. Now, what I want to add to that is please, you need to spend some time and money to be exposed. That is one thing. You see, when you are not exposed, you tend to think that what you are learning or what you're doing is just limited to what you are seeing. There is so much in the field of orthopedics that even if we have 1,000 orthopedic surgeons working in this country, everybody will still have a lot to do, a lot to eat, a lot to drink, a lot to do whatever they want to do, because there is so much to do in orthopedics. And there's so much work to be done. what we basically see, okay, fracture, trauma. There is a lot more than that. So there's so much to be done. Now, having said that, private practice or whatever it is meant to solve problems, isn't it? It means when there are problems, and then you devise means of what? Solving them. Now, what happens is that most of our government facilities cannot be able to solve all these problems. And there are still a lot of issues that are lacking in most of our government facilities. And most of us go to these facilities, we will complain day in, day out. The problems are not being what? Are not being solved. And we'll keep on complaining. So once you know that there are issues and there are problems, then you try to find solutions to these problems. And one of the ways is try to set up facilities that you can be able to work at your own what, beck and call, that when you need something, it is available, that when you want to go to theater at 6 a.m. or 5:30 a.m., you can go there. There are people you work with, and you'll finish at 7 a.m. or 8 a.m. If you want to go 12 midnight, you should be able to go. So the push is probably to try to solve the challenges that you face in the government facilities. For me personally, that was actually the push, so that I can be able to work at my own convenience, have what I need to work with without having to fight with anyone. And aside that, of course, if you are solving problems, something must follow. Whoever solves problem, something follows that person, isn't it? You don't go in first for that something, but you solve the problem and something will follow. It's as easy as that. Now, setting it up is quite challenging. If you are not ready to have headaches, then don't try it. Because once you want to set up a private facility, it means that you're going to work with people, you're going to employ people, and you're going to pay people. And you want people to work in a particular way because you want to set a standard. And you know, it's not easy managing people, to get people to align to what you want to do, your vision and your mission. So sometimes you must know that you go back home and you are so sad because you are saying something or you want people to do in a particular and they are not doing it. So that you should be ready for. I said that when you start that, when you meet those things, you should not be surprised at all. Then also the challenge of finances. Finances. That is one thing. But what I've learned is that if you have a plan, there will always be a way to raise the finances. But you have to start early. If you are planning to set up a private practice, please, you have to start early. There are certain aspects that you can be able to be planning towards even whilst you are in school. For instance, buying equipment that you might need in future. When you get some small money, you just buy something and leave it there. Because for me personally, in setting up my practice, a lot of the equipment I bought whilst I was a resident. So when I got a place to start, I had to buy some more things, but it was not like I didn't have things from the beginning. So sacrificing and buying things, even as you are in the process of training, will help you in the future. That when the opportunity comes, you can easily go into a private practice. And then also meeting all the requirements of the regulatory bodies is another headache that you have to surmount. But as long as you want to do it, you can be able to do it. I mean, forget about anybody telling you it's difficult and all that. Yes, there's nothing that it's not difficult. But once you've applied yourself to it, you'll be able to acquire all the necessary documentations and all the necessary licenses that you are required to do. And I believe once you get that, you start. And once you start, there's no turning back. The only thing you have to know is that you are sacrificing some aspects of your life. Because once you start, you will not have that time to go around like every other person goes around. Because once you know you have patients waiting for you, you have to go and solve their problems. And you cannot have time to be doing other things. So at least for the first 3 to 5 years, your time will be very, very limited for other activities. But I believe once you establish and the practice stands, then you can be able to have some respite. And there are other colleagues who will work with you. There are other doctors who will work with you. And once you have good rapport, you are likely to succeed. So in a nutshell, that's what I can say about that.
Thank you very much, Prof, for all the information and all the advice. Considering how interesting this topic is, I think Incision Ghana might have to consider getting a time to speak with you specifically on how to set up a private practice in Ghana. Our next question is to Dr. Koko. Some of our audience members are interested in teaching in the university. And one question we got was, what non-medical skill or training would you advise medical students or junior doctors to develop if they are interested in working with the university or teaching?
Uh, that's a good one. I think Papa Alexis is here. I mean, he has gone through. He's a professor now, so I'm sure he'll weigh in on this topic. But I think the most important thing, especially for your progression in the academic environment, is you need to be somebody who is able to write. And by writing, I mean publishing relevant research. And because that's really what would push you in your academic career. And as you research and ask questions and become more critical about the things that you are doing, the natural evolution of that is that you will get a deeper understanding of a lot of the things that you are doing. And hence also your ability to transfer knowledge also goes up. Because for a lot of the things, you'd have critically appraised before you start doing any writing on an area. And that is something that takes some academic rigor. So I think those are skills you need to acquire. The ability to do a critical appraisal of whatever it is that you are reading at any time. The ability to see through research from beginning to end and then to publish out of whatever research you have done. I think those things are key if you intend to go into an academic career.
Thank you very much, Dr. Koko. Please, to Dr. Clarence. So what we also want to know is what piece of advice would you offer any orthopedic surgeon or resident or junior doctor or even a medical student that is considering going into private practice or developing a company as you have also set up an information technology company? If they were interested in it, what piece of advice would you give them? Hello,
Well, in
Dr.
the space
Clarence.
I find, yes. So in the space I find myself in, which is bit of health informatics and health technology, it usually starts with an idea, and the idea has to solve a problem that's in the market. So a bit of understanding what the market is. Yeah, in our environment, there are so many problems in the health sector, the health administration, at various sectors, from private sector, sorry, from public health angles to it to clinical practice. There's just so many problems. And so you need to identify the problem and then come up with a solution. And once you have a solution, you can then build on that solution. So um, it's sort of what Dr. Ko just mentioned about going to research. You need to find a problem and then you find a solution to it. The difference is that I built a product around the solution that's supposed to that can then be deployed on the market. So for anyone who has such a solution, then the idea is to then put resources into building this product. You can't usually do it all by yourself. So you need to find a competent team and you need to manage the team to reach the outcomes that you have. So if a company was set up 2018 and we only started seeing results 2021. So it's a long time and you need to plan for what you're deploying. Funding is a very difficult thing to get for and in building a company like that because people need to eat on a daily basis. And sometimes when you are the doctor, you have another job, so you get to have a salary, and so you need to make sure that other people who are working with you to achieve a common goal also get to be remunerated. So you need there are various funding sources that are available in the world, and some of them can give you equity-free funding, some give you an equity-based funding, and that helps you to build whatever you're building. But I would say it starts with an idea, it starts with perseverance, you stick to the plan. New information can change the course of the journey, but shouldn't change what the main focus is. And once you stick to it and you spend time and you're diligent about what you do, usually you'd have in the end, what you're looking for is to find a solution to the problem. And once that solution is out there, usually someone is willing to pay for it. And that's the goal. I
Okay.
hope that answers
Thank
the
you
question.
very much. Yes, it does. It does. Like earlier on mentioned, I think when it comes to terms of setting up a private practice, is something that we might need to have a dedicated time to discuss. Hopefully, when we do so, we'd like to invite yourself and then Prof. Alexis to help us provide more information on that. So to our audience, thank you all so much for your time and your attention. The main part of the program is over. And what we are going to do is to look at the audience questions. So we have a question from Prince Kwame Boateng that I would like to twist a little bit before I get answers from Prof. Dr. Coco and Dr. Clarence. So to Dr. Anita, the question is, orthopedic practice in Western and advanced countries seems to be ahead compared to what we do in Ghana here. Does this have any effect on the competence of our specialists here, or is it a matter of resource, either availability or unavailability, that makes the difference? What we would like to know, Dr. Anita, is do you feel this is affecting your residency training in Ghana? This vast difference in resource access and certain amenities?
Hmm. Hmm. I think it's a matter of resource and not the competence of our trainers, because our trainers, we've seen people come from, like when we have this medvac, people from outside come to do some surgeries, and it's not anything different from what our trainers do. So I think it's just the resource. Yes, so if the resources are not there, definitely some of the things like how we are supposed to do, we may not know. But I believe there will be opportunities for us to also visit some institutions outside the countries, maybe who have all the other equipment in our for the training. And so, but with some of these lack of resources, I mean the machines, let me put it that way, the equipment, we are able to, improvise as always. We are improvising, and we are not doing anything lower than what they do. We get the results that we are supposed to get. It's not like improvising and doing what, yes, we get the results we are supposed to. And most of our trainers have they did their fellowships outside, and they are very competent. Let me just say that they are very competent and they know. So in the course of the training, we will go outside and get exposed to some of these equipment, and so it's not going to affect the training at all. That's what I would say.
Thank you very much, Dr. Anita. So, with that same question, Prof. Alexis already gave an answer, but we'd like to hear from Dr. Koko. What is your thoughts on this about the difference in practice of orthopedic practice both in the advanced countries and in Ghana?
Yeah, that's an interesting one. We cannot deny the fact that there's a difference. There is a difference in terms of resources available and generally in terms of the kind of practice. You see, for us here in Ghana, a lot of our practice, especially the public sector, it's cash and carry. So your ability to solve the problem of the patient is also dependent on the patient's resources. So that is one thing that at times will limit you in terms of what you want to do for your patient. But in spite of that, we find a way to deliver service to those patients to solve as much of their problems as we can. But Prof alluded to something about exposure. I think as a resident, as you are in the program, you should still be looking out for some of these opportunities for exposure. In terms of a lot of the time in some of our institutions, some of our training institutions, we have visiting people coming along. At times, your interaction with some of these people opens up a door for you to get exposed in a different way. At times, it's not even for a matter of the people coming around for you to get that exposure, but applying for certain things through certain avenues which are available for you to get some observerships or some internship or even a fellowship outside the country to go and learn something that probably we are not doing here. In terms of the training, I would say that for the principles of orthopedics, the practice of orthopedics, you would be able to get everything you need to practice. Don't forget, one thing that I always say people should not forget is that you are trained for the environment in which you find yourself. The people in the West are training for people for their environment. There are certain things they do that we want to bring here because we're not doing so much of them. But you quickly realize that for somebody who is fully trained there, when the person comes here, at times it's difficult to adapt unless you create the kind of system that they have there. And one of the things you will quickly realize is that once you create that system, the cost of your care quickly becomes very, very, very expensive. We have examples in Ghana, right? It's not because of anything, but because it's just that what you need to achieve that they use to achieve the results they have, what they know to use requires that the cost is that expensive, right? Others may use less resources to achieve similar results. So once again, what I would say is that, yes, there are opportunities out there. Yes, make good use of this opportunity, expose yourself. At the same time, try and find a way to solve problems that are local with resources that are available to you. It's good. I think it's better for you to train here and go and do a fellowship out there and come back. And I'm mentioning come back because I want everybody to come back because we need people here and not stay there. Come back and try and adapt our system to solve the problem. Because when you train here and you go, you know the problems that you're going to face when you come. The things that are going to be deficient, that you will not have the system like they have there. And you would also know how you would adapt your practice to be able to perform the things you need to do, the service you need to do, or provide the service you need to do once you do that. Thank you.
Thank you very much, Dr. Koko. We had a question from Ferdinand Akapo asking about any specific books to start reading before starting residency. It was answered by Dr. Anita, who was recommending Apley and Solomon's BRS anatomy, BRS physiology, and pathology. So our final question for our audience, our panel, sorry, will be to Dr. Clarence. And please, are there any strategies or resources you'd recommend in preparing for the residency exam in orthopedics?
I'm sure you mean the primaries exam.
Yes, primaries.
Yes. So I think Anita will be best positioned to answer that because I didn't write the direct orthopedics primaries exam. I go through my membership. So she is best positioned to answer that.
Okay, thank you. Dr. Anita, if you can help us with an answer on the strategies or resources someone would need for their primary exam.
So those are the books basically you will need. And then usually with anatomy, physiology, and pathology, as you are reading, you don't just read them in abstract. You have to be solving questions. And BRS has some questions in them. So as you read, you solve questions. However, if you are writing West Africa, you need to add biomechanics. That one, I don't know. I went and I saw it, the questions there. So West Africa has biomechanics in addition to the anatomy, physiology, and pathology. But Ghana College is the anatomy, physiology, and pathology. So you write primaries, and if you want to do for Ghana College, you go for the interview to be selected. You have to pass the interview exam before you be allowed into the residency program. For West Africa, I don't think there's an interview. When you pass the exam, you can send your certificate to the center you want to be trained, and then think with a letter or something, and then you are allowed to do the program. So that's what I can say.
If
Okay,
I may
thank
come in
you.
a bit here. So in terms of West Africa, they have currently 2 training centers. That's Kumasi and Korle. That's Konfanochi and then Korle. So it's subject to availability of space. It's sometimes easier to go through with the gun. Sorry?
We also do.
Oh,
Tamale too.
yes,
Tamale is also
and Tamale too. So it's subject to availability of space. Ghana College does direct postings of residents to the training institutions. So sometimes it can be a little tricky when you're coming in with West Africa because I think the balance in terms of numbers sometimes do not favor you when you are with West Africa and going to a center that has a lot of people applying to it. So I advise all to come in with both Ghana College and West Africa College if you can. It's usually a best route to get into the training center that you want.
All right, thank you. Thank you all so much for your time, your attention. Thank you so much to our panelists. Originally, this program was supposed to last for an hour, but the conversation was just so interesting and we're learning so much. We just lost track of time. So we'd like to hear from our education lead, Jonathan, to give us the closing remarks. Hello, Jonathan, are you with us?
Hello?
Yes.
Hello?
Hello.
It's been a great evening for me, and I would want to believe it's the same for all our other attendees and then our panelists. And I'm most grateful for all our surgeons for taking time off their busy schedule to come and educate us, interact with us. And we are looking forward to such more interactions. So as Dr. Munir earlier indicated, we may want to reach out to Professor Alexis and Dr. Clarence on a webinar on the private practice in orthopedics and trauma. And I think that is one of the things that is motivating me to go into orthopedics and trauma, because I feel there's a lot of opportunities in terms of private practice that gives you a lot of free hands to do things at your will and then for the benefits of the patient. So I'm most grateful to everybody for joining, most especially to our panelists, and we look forward to a more exciting future with Incision Ghana. I'm most grateful to everyone for joining. So thank you so much, and thank you so much for joining us today.
Thank you.
Thank you all so much. Dr. Dorcas has put the links to our various WhatsApp platforms. This is a program that we organize every 2 to 3 months. So hopefully, somewhere in July or in the first week of August, we'll organize one, this time with a different specialty in mind. Either we would discuss neurosurgery or obstetrics or ophthalmology. So if you want to hear more about our programs and join us as soon as these programs are organized, please join our WhatsApp platforms. It's in the chat. It's been uploaded by Dr. Dorcas. So once again, on behalf of everybody, we thank you so much, especially to our panelists, to Prof. Alexis, Dr. Coco, Dr. Clarence, and Dr. Anita. We are immensely grateful for your time and your help in making this program a reality. God bless all of you.